Good morning, everyone. Welcome to today's presentation. I'm excited to share with you some important insights on inflammatory bowel syndrome, a key topic in general medicine. Today, we'll be exploring the main types, including Crohn's disease, ulcerative colitis, and pseudomembranous colitis. Over the next few slides, we'll delve into each of these conditions, their characteristics, and clinical relevance. So, let's get started and explore this fascinating subject together. Today, I want to talk about Crohn's disease and clear up some common misconceptions. First off, it's important to note that Crohn's is not an autoimmune disorder, which sets it apart from other inflammatory conditions. Instead, cytokines, particularly TNF-alpha, play a significant role in its development. When it comes to the affected areas, the most common site involved is the terminal ileum, the final part of the small intestine. Interestingly, Crohn's tends to spare the rectum, which is quite different from some other inflammatory bowel diseases. However, it's also important to remember that Crohn's can involve the entire gut, from mouth to anus, making its presentation quite variable. And one of the earliest signs we see in patients is the appearance of aphthous ulcers, those small, shallow sores that often serve as an initial clue to the disease. Understanding these key points helps us better recognize and manage Crohn's disease, especially considering its variable presentation and the role of cytokines like TNF-alpha in its pathology. Now, as the disease progresses, we see it causing deep serpiginous ulcers throughout the entire gut. These serpiginous ulcers, especially in the esophagus, are a characteristic feature of cytomegalovirus, or CMV, infection. What's interesting is that as the inflammation becomes more extensive, it involves all layers of the gut wall, leading to transmural involvement. This means the damage isn't just superficial, it affects the full thickness of the intestinal wall. This transmural process, combined with submucosal fibrosis, gives rise to an irregular mucosal appearance known as the cobblestone pattern. Think of it like uneven, raised areas that give the mucosa a cobbled look. Sometimes, you'll notice areas that are spared from ulceration, called skip lesions. These are patches where the mucosa appears relatively unaffected, interspersed between the diseased segments. All these features, deep ulcers, cobblestone appearance, and skip lesions, are important clues that help us understand the severity and pattern of the disease, connecting back to the overall theme of how infections like CMV can cause significant structural changes in the gut. Let's delve into the clinical features associated with Crohn's disease. One of the hallmark symptoms is colicky pain, which occurs due to the formation of multiple strictures in the intestines. These strictures cause a sort of intermittent, crampy pain that can be quite distressing for patients. Additionally, intra-abdominal abscesses are common, resulting from localized infections that develop as the disease progresses. Serosal inflammation, which involves the outermost layer of the intestine, also occurs and can lead to significant pain and complications. Now, perhaps the most distinctive feature of Crohn's disease is the formation of fistulas. These abnormal connections can develop between the intestine and other structures. For example, a perianal fistula can cause sepsis and local infections around the anal region. There can also be vesicocolic fistulas, which connect the bladder and colon, leading to urinary symptoms. And enterocutaneous fistulas, which create an abnormal pathway from the intestines to the skin, often require thorough workup to properly diagnose and manage. Understanding these features is crucial because they help us recognize the complexity of Crohn's disease and guide our approach for effective treatment and management. Let's walk through the workup process for this condition. First, we have the ASCA test, which stands for anti-Saccharomyces cerevisiae antibody. This is a blood test that can help support a diagnosis, especially in cases like Crohn's disease, where it tends to be positive. Next, imaging studies are crucial. We often start with wireless capsule endoscopy, which allows us to get a detailed view of the small intestine. Depending on the findings, we might also do an upper gastrointestinal endoscopy or a colonoscopy to examine other parts of the GI tract directly. If we need more detailed imaging, CT enterography is very useful. It provides high-resolution images of the small bowel and can help identify inflammation, strictures, or other abnormalities. Finally, the barium meal follow-up, which shows the classic string sign of Cantor, indicates a stricture formation. This sign appears as a narrowing of the bowel lumen caused by fibrosis or inflammation, and it's an important radiologic feature that supports the diagnosis. Overall, these tools together help us confirm the diagnosis and understand the extent and nature of the disease, guiding effective management. Let's now discuss the treatment options. When it comes to managing these conditions, the drug of choice is generally steroids, which tend to be more effective than mesalamine. However, depending on the specific situation, other medications may be used. For example, in cases of bile acid diarrhea, cholestyramine and cholestyramine are commonly prescribed to help bind the bile acids and reduce diarrhea symptoms. In more severe or refractory cases, immunosuppressants like azathioprine can be considered to control inflammation. Additionally, infliximab, which is a TNF-alpha antagonist, is particularly useful not only for reducing inflammation, but also for promoting healing of complications such as enterocutaneous fistulas. Now, focusing on the first step in managing perianal fistulas, it's crucial to maintain good perineal hygiene and start with antibiotics to control infection and inflammation. This initial approach helps set the stage for further interventions and improves patient comfort. Throughout this presentation, we've emphasized that treatment strategies are tailored to the severity and specific manifestations of the disease, always aiming to control symptoms and promote healing effectively.